Carry the three, whatever the hell, and yeah,
Yeah.
maybe we'll need more than 1 million listeners, but hey, let's make that the goal, to save
I
1 billion cochlear hairs.
I think it's amazing, and I think it's achievable.
I do too. Right. I think it is. There's
Yeah.
so much, just the small things, like anything. It's the little things that you can do to just sort of save, protect yourself a little bit more so that you can hear better for longer. Right.
Yeah. That's amazing. I love it.
So that's the goal. Welcome to the Tinnitus Manifesto. Today, we are interviewing Dr. Grome about her, sort of from her perspective as an audiologist, the particular care that is required, or the different things that you kind of need to do or you like to do when you're interacting with musicians compared to the mere mortals with hearing loss. Right? Give me
Yep.
just a little background. Go ahead and just sort of give me a rundown.
Yeah. So I bought my practice, Ears for You Hearing Services, 5 years ago. There was a man retiring, and he was trying to essentially offload his practice to make sure there's a provider there to continue patient care. He had been in business, I think, 34 years when he retired. And so I bought my office just because I was a rep for a hearing aid manufacturer. I was on the road, I had kids, and my husband and I lived here in Nashville, and I just really wanted not to be traveling anymore. And so, yeah, this office I had been watching for a bit. And when he was finally ready, it just kind of worked out that we came to an agreement, and I took ownership. Now, the crazy thing of that, there's a lot of crazy things about that. Number one, I did not go to school to be a business owner. I went to school to be an audiologist. So there was a big learning curve there.
Right.
The second thing that was kind of surprising is it's in Nashville, Tennessee. I just assumed that everyone here would kind of know how to handle musicians, because you guys are a unique crowd of people. Like,
yeah. Right.
Yeah, so different needs, different issues popping up. We're navigating a different demographic than I was used to, coming from the hearing aid side of things. So yeah, I was really slapped in the face with not only running a business, but I had this huge influx of musicians coming in with a lot of concerns that I wasn't prepared to accommodate.
Well, you're in just the location of that office. You're right. You're surrounded by probably literally 30 recording studios. You're in Berry Hill in Nashville, which is
Correct.
There are some very well-known, very respected studios, literally probably 20 or 30 of them within a couple blocks of you.
Correct. Yeah. And that was the thing, is people were just like popping in being like, hey, I'm around the corner doing this. Can you help with this? And I'm like, oh, yeah,
right.
I got to educate myself on this. And I just wasn't prepared, but I very instantly had to throw myself into educating in a whole different class of thought process and clinical procedures that I wasn't used to. So
what are the differences that you've had to right?
Yeah, I have to be Jekyll and Hyde, essentially. Okay, so the first thing is wax removal. A lot of audiologists will not perform wax removal.
Right.
Now, I did a lot of training in the VA, and so you have to, be proficient at that.
Right.
But a lot of audiologists really don't feel comfortable. So I had to buy a lot of equipment, and I had to essentially get comfortable with wax removal. That was the first thing.
Right.
The second thing is usually musicians are not very educated with general medical dialogue.
Right.
And so I remember even before getting into the musician audiology mindset, there were so many times musicians would come in here for impressions and say things to me that flat out aren't true. And so, number one, I had to curb my initial reaction of immediately correcting that.
Right.
Because I'm 5'0", I look like I'm 12 to most people, and they don't believe me.
Well,
which is
there's
fine.
that too, and they're also, I mean, that's I will speak for myself as a musician going into an audiologist. It's a nerve-wracking experience, right?
Correct. Yeah, their
And this
anxiety is on a 10.
exactly. I mean, this is again back. This is why we're doing this podcast. We're putting a musician with a shitty hearing and an audiologist in a conversation just to sort of get rid of some of that stigma. That's why
Yeah.
we're here, to break some of that. But it is true. I mean, I'll be the first to admit it. You go in, you almost feel like the audiologist is judging you, like you're going to fail a test, all those kinds of, yeah. And that's the baggage you have to deal with when a musician comes in to your office, right?
Yeah. Absolutely. Absolutely. Yeah. So tinnitus is a big topic too with
Yeah.
musicians.
Right.
Historically, they've all been told it is what it is and there's nothing you can do about it. Um, there was taking impressions on a musician is different than taking an impression on a hearing aid patient. We need a much deeper impression. We
Oh,
need a
right. Oh,
full
wow.
helix lock. There's very specific instructions. I'm sure multiple musicians who are listening have gone someplace to get an impression for an in-ear monitor, and the in-ear monitor company rejects that impression. And it's because when we
It's
do impressions for hearing aids, it's a different thought. It's a different, we don't
uh
need to get the full ear when we're doing
right.
them. I do it anyways now because that's my habit.
With a
But that was a
hearing
big
aid,
one. Yeah,
like you
yeah.
don't
So
have to, but with in-ear monitors, it needs
you
to be
need
a
the
sort of a
helix lock.
deeper
You need the second bend. I want to know exactly past that second bend. Does your ear canal go straight up? Because they're putting a speaker right in your ear. And if they're
yeah,
pointing it at a slope and it's hitting your ear canal, then
and
you're going to
bouncing
get an
off.
intermittent monitor. Yeah.
Ah,
So
interesting. Yeah.
that kind of stuff. Yeah. So, usually with my hearing aid patients, I try to be a little bit more reserved, a little
Right.
bit more quote unquote professional.
Uh-huh.
But I feel like with musicians, the easiest way for me is just come in there and crack a joke or,
Yeah.
ask them like, what are your goals today? Or, what are you doing with this? And when you're singing, are you making a funny face? And that kind of, a lot of times they're like, well, why are you asking that? I'm like, well, because I want to know what your face is going to be doing when you have these in your ear.
Right,
And,
because it might
and so,
alter. Right.
yeah, so it kind of opens the door of like, hey, I do know some of the issues that you might be having.
Hmm.
It just kind of opens the door. Like, do you want to talk about that?
Right. Right.
So, and that is a question I asked too. Like, hey, you're just here for impressions. You have my attention for the next 15 minutes. Is there anything you want to talk about?
Yeah. And this is one thing I have thought about, because you do sort of have to walk this line. You're not a therapist. You're an audiologist, right?
Well,
People
I
coming
feel
in.
like sometimes I am a
I know that's what I
therapist,
mean. And
but
right. And it again, as a musician coming in, they're in this, you know, just the fact that they're coming in, especially if they're not there to get in-ear monitors, if they're there to get tested or there because they have a concern, right? They're already, it's like, already a little bit anxious, and and again, it's the psychological stuff, right? That the
correct.
baggage that they carry in with them. And that's one thing you must have some challenge with that, where you're dealing with, the emotional part of a person, not just their ear. You're dealing with, to some extent, these people think their lives are in your hand. Their musical lives are in your hand, right?
Yeah. Yeah.
And
I mean, it's really challenging
yeah,
for
it's
them.
scary for both, for them. And you understand that, like, so like you've gotten better at this. Like you said, when you, got this office here in Nashville, that was one of the, just adjusting to the personality of musicians and their needs compared to, say, again, those mere mortals, right?
Yeah. Well, also your language is different. So,
Yeah.
my hearing aid patients don't come in and talk about pitch and frequency and dynamic range and tuning, but musicians do. They,
Right.
just
Yeah.
yesterday, I had someone come in. He's been wanting his hearing tested for a very long time. And one of his friends had just been in here. So, word of mouth, they said, go see Dr. Grome. He walked in, he sat down in my chair, and he said, I'm pretty sure I have like something going on at 2000 hertz in my left ear, but my right ear, I'm assuming it's probably around 9000 hertz. And I'm like, okay, well, challenge accepted. Let's see how close you
That's a
are.
test. Yeah. How was it?
And sure enough, he was almost right on.
Wow. Wow.
Yeah, it's really interesting. Each musician profile is very distinct. Like when you say I'm sending a drummer to you, and I'm like, oh, okay, click
So you,
track, yay, can't wait.
oh, click track, right.
Whereas like a bassist, it's like
Uh-huh.
anyone playing bass, bass people love to hear themselves. They love being like so loud and feeling it. And I'm like, okay, you're over amplified. That's great.
You're right.
Whereas
It's true.
lead singers always popping an ear out, because they
Yeah,
can't. It's like,
right.
okay.
That is true. No, it's Frank Zappa wrote an autobiography many years ago, but he sort of one chapter was just about all the different musicians in an orchestra and their personality traits. It's very
Oh, I
funny,
need to
very
read that
funny.
book.
Oh, it's hilarious. Yeah, there are definitely particular, not just, personality traits, but also hearing and what they need and that kind of thing, right?
Oh yeah,
Yeah.
correct.
Yeah.
Yeah. So yeah, I mean, when I started here, it wasn't even 6 months where I flew up to Sensophonics in Chicago and was hounded on Mike Santucci up there to kind of give me his wisdom because again, in Nashville, I just assumed everyone, all the providers here would be doing everything that needed to be done for musicians, and I found that wasn't true.
Okay.
So
Right.
when I bought the office, I had to buy all new equipment essentially
Yeah.
too, because I was getting hearing test after hearing test after hearing test from another provider in town or a hospital system in town where they were going and asking for help with a certain complaint, mainly tinnitus, mainly ringing in the ears,
Right.
mainly difficulty understanding a noise. And I'm getting an 8,000 hertz hearing test. I'm like, okay, where's your extended high frequencies? I mean, that
Right.
that should be a
Yeah.
standard test battery with musicians,
Right.
because noise exposure doesn't always present itself below 8K. And so, just kind of navigating like what is the best protocol for musicians when they come into the office, and getting myself educated to be set up to essentially navigate those more challenging conversations
Right.
because it's not easy, and if it
Mhm.
were easy, everyone probably would have been doing it.
Yeah.
So
Right.
yeah, so it was definitely a learning curve for me, and I promise you, I learned something new every day
Hmm.
at work, specifically with musicians. But I think I'm getting a little better. 5 years.
There's a learning curve even in musicians of understanding what frequencies are like, and of course in this whole thing when we're talking, we're not just talking about musicians, we're talking about producers, sound engineers,
Anyone
uh
with noise exposure.
anyone, yeah, who's dealing professionally with sound in that way.
Yeah.
So they, it's a more general term. Musician is
Yeah,
sort of
I
a
use
larger.
musician as anyone in the music
Yeah,
industry.
agreed.
Hmm. Yeah.
Exactly. What would you suggest audiologists need to do? And what do you suggest musicians need to do to sort of get that bridge a little closer, to get the communication a
Yeah.
little easier?
Well, I think audiologists, there's a lot of different placements for us to work in.
Right,
Now, I have full flexibility over my decisions as an audiologist because I'm in private practice and that
yeah,
practice is owned by me.
right.
But if you are an audiologist working in an ear, nose, and throat setting,
You have to answer to other people.
correct, and you are not in charge of what equipment you have most
Right.
most of the time.
Hmm.
You are not having the conversation with the patient most of the time,
Right,
because they're going in and they're getting a very quick 15-minute hearing test from the audiologist and then being shoveled over to the ENT.
right, right.
So some
I've been
audiologists,
there. I've been there. I know
yeah,
that.
yeah,
Yeah.
they're not in control of their schedule. They're not in control of being able to sit down and saying, "Oh, you're a musician and you have these concerns, or you have noise exposure and you have these concerns. Here's what we should be doing." They just don't have the opportunity to do that. I think one thing in audiology that I have seen historically is we love hoarding our own patients. We love making sure that we are the expert and that we are keeping our patients as close as we can because of all the competition.
Right.
But not every provider has the same skill set. So I think the best thing for audiologists to improve on is to find your own areas of weakness
Right.
and have the confidence to go out and network with those who may have strengths in those areas of your weakness.
Right.
That way you can refer someone to someone else who might have a different skill set.
it takes a level of confidence, self-confidence to be willing to do that too, right?
And teamwork.
And
Yeah.
teamwork.
So yeah, it's same thing. Whenever anyone calls my office and asks, and I do this all the time, I'm terrible at taking notes. I'm terrible at writing my reports. I keep it all in my head, which, that's not great because that's going. But so anytime anyone calls my office and is like, oh yeah, I'm actually at this ENT, can you fax over my chart notes?
Right.
I'm like, oh crap, they're gonna
Yeah.
see something in there that they don't agree with and they are gonna judge me.
Okay. Right. Right.
But then I have to remember, you know what? They might not know why I did that test. So number one, I need to work on my documentation. And number two, they might be looking for something completely different than the reason that person was in my office.
Right. Right.
So, but as audiologists, we really don't have that. What we all know each other, but
Yeah.
we all don't enjoy sending our patients elsewhere.
Okay. And
Yeah.
so my thought was, when you brought up this topic, is maybe musicians are better off seeing private practitioners instead of going to a larger hospital to get tested, or a larger ENT. Like maybe that's,
Not
as we're
necessarily,
talking.
just
Okay.
just kind of do some research on who is proficient
Yeah.
in
Right.
musician-based products. So
Right.
if you, again, I'm going to talk about Sensophonics. Like if you go to Sensophonics, they're an in-ear monitor company. They have trained audiologists that we have had to go through their educational program
Okay.
to be able to be a provider for them.
Yeah. Prescribe
So,
that.
yeah, go online and do some research about who are the in-ear monitor companies sending you to for impressions.
Okay.
Call up that place and say, "Hey, are you also proficient at testing? Do you specialize in tinnitus? If you don't specialize in tinnitus, who in town is the go-to for tinnitus?"
Right.
Just ask those questions. I know I get a lot of referrals from my Google reviews just because people are commenting like, "Oh, I've had tinnitus and Dr. Grome listened." So
Right.
that in itself has brought in a lot of patients. But yeah, I think musicians just don't really know how to navigate that
Yeah.
because it is a unique mindset essentially. So
In retrospect, and again, I'd never, like I said, this is just sort of crystallizing a thought that hadn't really thought about. But I know, speaking for myself as a musician, as someone, and again, just more sort of emotionally connected to my hearing, I think for me, I prefer sort of the smaller, the local, the independent
yeah.
group, as opposed to, like you said, you get tested and then you get sent to the ENT and then you get sent to someone else and you get sent to someone else.
Mhm.
I think when it comes to musicians, in particular, we really want people to know, right, more
Yeah.
deeply us as people and what our hearing issues are, and that, that's where I think, a little more sort of individual attention. If given the choice, I would recommend that over going to a larger facility.
Yeah.
And again, my personal thought.
Yeah. And I mean, I don't want to discredit any provider
Oh yeah.
at an ENT or a large hospital system because a lot of times you take the job that you can get.
Hell yeah.
Again, if you're
Right.
tied to a city, you do what you need to do to work.
Yeah.
And sometimes they're just not afforded the follow-up and the opportunity to have these really challenging conversations to learn.
Yeah.
And there are definitely times where I'm sitting with someone and I'm like, you know what? You're in the wrong office because I'm going to have to send you to an ENT because, for you, talk about eustachian tube dysfunction. That's very common with musicians. We're dealing with TMJ. That's
Okay.
another, big conversation that we have.
Interesting.
Sometimes there's medical things that pop up that
Right.
need addressed. Sudden hearing loss. I cannot treat sudden hearing loss. I can do your test and I can refer you over to the hospital system
Right.
and tell you, do not walk out of there until you get your transtympanic steroid injection. but,
Yeah, right. Because
I
that's
can't
an
do that.
infection, right? You're talking
Yeah.
about infection in the ear, possibly,
Yeah,
that kind
sometimes
of
like a
thing.
viral infection, sudden hearing
Right.
losses need to be treated within 48 hours.
Yeah, or you're screwed. And
Or
that's a good bit of information to you musicians out there.
don't sit
If
on it. Musicians
it,
are great at not doing anything for a long
amen.
time,
Not, oh, we're terrible.
flushing their ears out for 2
Yeah.
weeks.
For the listeners out there, if you do notice something fairly sudden, in particular about hearing loss, get in and get it
Get
looked
in.
at.
And
Go.
that is one thing
Don't
too. I
waste
will
time.
always squeeze someone in for a sudden hearing loss. That's
There
like
you go.
that's
Right.
an emergency situation.
It
So
is, exactly. Right.
it
Because,
doesn't matter. That's one of those like, hey, you don't eat lunch that day, and that's fine.
mhm.
So
Yeah, because, and again, we're trying to save those billion cochlear hairs.
billion hair cells. Yeah. Oh yeah. Yeah.
Um,
And that's why I'm so I am pushy. I am going to say it. I am a pushy provider when it comes to getting a baseline hearing test. One of the things that really and I try to tone this down. I'm going to get my blood pressure up here. I really don't enjoy when people come to me for impressions or wax removal from the music industry and don't get a baseline hearing test. I have a very hard time with that. And I have a scary story now, but I did have someone who I got a little pushy with because I was doing his impressions and he's telling me all these issues that he's having. And I'm like, okay, well, why are you spending money on a in-ear monitor system and you don't even know if it's doing its job? And so, we went back and forth, and I got called a few names, but he ended up in the booth. And I got a baseline hearing test on him. And sure enough, 9 months later, he woke up one morning and could not hear out of his left ear. And he was having a heart attack. So he calls the office, just obviously, this is very traumatic for him,
yeah,
singer-songwriter. He has
right.
a whole lineup of stuff to do over the weekend. And he comes in, and sure enough, he has low frequency, sudden sensory neural hearing loss in the left ear. I would not be able to know that if I didn't have that baseline hearing test.
Right. Yeah, exactly. And then, you're giving a misdiagnosis, you're giving bad prescription because you don't have those details.
Correct. And what is an ear, nose, and throat physician going to say? I don't know. Do you know what I mean? Like, they're not going to squeeze someone in last minute if there's not documented proof that there
Right.
has been a change in hearing.
Right.
Because I don't know if anyone's called an ENT recently, but you can't get in for 4 to 6 months.
Okay.
So,
Yeah. Really?
yeah. So
Okay.
if we're going to be squeezing someone in last minute, we have to have that proof for the ENT, clear cut. This is the baseline. This is today. This needs to happen immediately.
So, yeah. So in general, that's one of the first things you always want to do with a musician is give them, when they first walk in, give them a hearing test, whatever it is they're trying to get, right? If they're coming in for an in-ear monitor, you want to give them a
Baseline
test.
hearing
And
test.
again,
Yep.
right. And what's the point? Like you said, how can you EQ a monitor, in-ear monitor, the way you need it if you don't know what your
Also,
levels
musicians
are?
come in and say, I'm getting this in-ear monitor. They view it as hearing protection. It can be hearing protection.
Mm-hmm.
It can reduce the amount of noise coming in your ear.
Mm-hmm.
But the output of an in-ear monitor is just as high, if not higher, than most of the hearing aids that I fit.
Right. Right.
So yes, we're isolating you from external noise,
But you don't want
but
to blow them out either.
yeah, how loud is your pack? What are you
Right.
keeping it at? And
Yeah.
especially when people go from no in-ears to their first pair of in-ears, or they go from an ill-fitting pair to a new tight-fitting pair, they lose that kind of general external awareness. They lose that feeling of performing on the stage. They feel
Right.
isolated.
Yes.
And so they crank up their pack.
Well, that's the most common complaint, or in my experience talking to musicians, that's one of the biggest things they don't like about in-ear monitors, right? Because it's an isolating thing.
Isolating.
Because you're hearing, the only sound you're hearing is coming from the monitor. You're not hearing the speaker, right? You're not hearing your amp. Maybe you can stand in front of the bass speakers and you feel the vibration behind you, but still the sound is only coming from
Your feed.
From the feed, right?
Yeah.
So we're going to get into this topic a lot in future episodes, just in the neurological malleability of the brain, right? When people, I know in my experience, when I get a new hearing aid, getting a different hearing aid, it's months for me to adjust to the thing, right?
It takes a bit of time.
It doesn't matter how good it is. Like, it's my brain that needs to adjust. And it's the same way with musicians when they get those in-ear monitors. You're used to being on stage and having, and again, this excitement, this aliveness in your sound that you hear environmentally, right? And there's also there's reflection, refraction, there's all this, bouncing off the wall. And that's what gives it the sound, gives a lot of life to sound.
Yeah,
So when you put in your monitors, you're not getting any of that, right?
correct.
So
Yeah.
do you find this to be a challenge in getting musicians to actually use in-ear monitors, like because of this?
Um, I think it's a challenge in getting them to use them appropriately.
Okay.
Also, I am looking at this exclusively from a hearing conservation standpoint. Um, that's where there's a disconnect
Yeah, right.
because every aspect of where I'm coming from is how do we reduce the stress or the load on your
Hmm.
ear so you can prevent damage from happening and
Right.
continue to do this long term.
Yes. So there
Whereas,
has to be a sacrifice a little bit, right?
well, not always, but yeah, especially in the beginning, it might seem like a sacrifice.
Right.
I would say it's more of a learning curve.
Hmm.
And some people don't have the luxury of a monitor engineer or a sound guy to work with.
Yeah.
So, that's a big part of it too. It's not just me and the musician. It's we got a team of people that we have to communicate with.
Right.
Um, so that, understanding that language and having those conversations and how involved do I need to be and how involved does that monitor engineer want me to be involved? That's a little bit of a song and dance as well. So
Right.
yeah.
So you actually do work with with production companies or labels, right? Like, so they might reach out and say, hey, we've got this band and we want to have them all tested and just, you do that kind of thing, right? Where you
I do. Yeah,
and
usually that's like management. Yeah,
right. Okay, yeah.
tour
So
managers. Mhm.
now this seems it made, when you told me this, I was actually very happy to hear. Like when you'd mentioned that a while back and at one point or another in a conversation, and I thought, wow, finally, like the people in the business actually give a shit about their musicians, right? And they care about, you know what I mean? It sounds silly, but like what a concept. Let's try to protect our musicians' ears. These people that are working for us, that are making us money for this label or whatever, let's make sure that they can, that they're healthy, right? It's just like any other business, making sure that they're that their workers are healthy. It's so obvious you almost can't believe it, right? Like, of course management or record labels or whatever should be trying to encourage their artists, their players, their musicians to make sure
To
that they're,
be, yeah, to
yeah.
be educated on hearing health.
And
Yeah.
what's your experience with that in
Educated
general?
by a audiologist or a
Yeah, not a
healthcare
manager.
provider. The hearing health.
Right.
Yeah, let's like the deep dark internet is just not the place.
Yeah,
And
no,
so and so
exactly.
sound guy at so and so studio should not be giving advice
Right.
on hearing conservation.
Yeah.
Some managers are very easy to work with and communicative with
Right.
me about um they really have their band's best interest at heart. And so that is always such a good experience when I get a phone call from, I'm thinking of one in particular, just the dialogue between us
Hmm.
when he runs into issues with his band members
Right.
is great. Like I'm
Yeah.
always like, please email me if you have a question or a concern or you're running into a consistent issue.
Right.
Even just even if it's you don't want my opinion as an audiologist, it's just another set of eyes on it.
Yeah. Yeah. Totally.
Yeah.
Right.
It could be
Uh,
something so small that you've just knocked your head, against the wall about 50,000 times and you just a fresh perspective.
hmm Do
So,
you so in those experiences, when you like, so what happens? Do they actually do, like, will just all the band members just come in, or do you meet them on, do you go to maybe to
it
where they're
depends. I do,
rehearsing or whatever, that kind of thing?
yeah, I do end up at rehearsal studios
Right.
often. I don't mind doing that because I
Hmm.
will take any sort of time in front of a musician to try to educate them.
Right.
It's just more challenging to do things off-site than it is in my office.
Okay.
But yes, sometimes they'll trickle in, they'll be in town for a month rehearsing, and so they'll just trickle in over the month.
Right.
Sometimes, I have to drop everything and go on a Tuesday morning down to sound check and knock out 15 impressions and 10 hearing tests and all that
Right.
stuff. It just depends.
And the response of the musicians, what are they usually happy to be doing this stuff, or are they, again, it's sort of are they intimidated? Are they, all, are they getting graded? Do they feel like they're getting graded by the teacher?
Most of them are very pleasant. There's always some bad apples that I would just love to smack, but
Yeah.
I
Okay.
refrain from that.
Right.
Yeah, I mean, I look at it as if someone's sitting there because they were told to be there and they don't want to participate, that's their choice. I can't
Right.
change that.
Yeah.
So I can, at that point, I usually just don't talk a lot and I just do my thing and continue on. But if they want to engage with me, I will absolutely engage.
Okay. So if they want to engage with you, you're like they ask you, okay, what things can I do to just sort of protect my hearing and control tinnitus? What are your first answers? A musician, you're giving them advice on how to protect their ears. What are the like maybe top 5 or whatever things that you recommend for musicians in general?
Well, I would love for it to be an easy 5 things, but I would say I need a lot more information before I give them a recommendation.
Okay.
So most common situation comes up where I'm again doing an impression off-site and someone just is like, oh yeah, I have ringing in my ears and there's nothing you can do about it. And da, 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 da. And so I say, well, there are things that you can do about it. And I ask them, when did it start? What does it sound like? Is it even in both ears? What brand of in-ear are you in? That way I kind of know EQ wise what's going on. What
Okay.
is your feed? What do
Right.
you listen to in your feed? Because if you're pounding out a 4K click track,
Right.
and
Yeah.
well, yeah, we might have a problem there.
Yeah.
So, what level do you keep your pack at? How long is your show? Are you standing stage left or stage
Right.
right?
All that should
Outside,
matter. So all those things matter.
yeah,
They're
yeah. Like, do
factors.
your ears ring after a concert, or are you feeling pretty isolated? Do you take
Mhm.
one out and leave one in? Outside of
Which
your
seems to be a
standard,
common thing. That is
yeah,
something I see on stage is, again,
yeah.
people are wearing like headphones and they'll be playing with, just a little bit off, and then like just so they can kind of control the outboard sound compared to
I feel
the
like it's more
feed
common with
sound.
musicians just from an occlusion standpoint. It's hard
Right.
for them to hear themselves normally
Right.
when they
Right.
have, in-ear monitors in. But yeah, no, I mean, those are all things that I ask. And then I always just say, like, hey, there are definitely things that you can do for tinnitus. It depends on when it bothers you. It depends on, if it's an awareness or a reaction. I use that phrase a lot. I'm okay with an awareness. It's
Hmm.
there.
Right.
I'm not okay with the reaction. So
Yeah.
if it hurts my belly, it gives me anxiety, I can't sleep, or I have
Right.
to drink because it takes my
Yeah.
mind off of that. Those are
Right.
reactions to tinnitus.
And that turns into a cycle, kind
A
of
cycle
becomes
of
a
different
cyclic,
things.
yeah,
Yeah,
because you get anxious, and then I know from my experience with tinnitus, right? The more upset you get about it, the more you notice it, right? And
correct.
it's a vicious cycle, right?
Yep.
Where you
As soon as
start
it
paying
hits your
attention
limbic
to,
system, yep,
yeah,
it gets in there.
it just, and it amplifies. It's a feedback loop almost, right?
Correct. Yeah.
Uh, so
Yeah, so I mean, usually from there, once I get a little bit more information, if I can recommend, like, hey, just maybe try having your sound guide move your click to a different frequency, or maybe use a burst, or maybe your in-ears don't fit right. So maybe I can bring my Dremel over and we can modify it a bit, or, maybe you can use a comply wrap to help with a fit. And then
right,
from there, see if you still have ringing, if it bothers you at night. Here's some sound therapy things that we recommend, but ultimately it always boils down to you need to see someone for a 20K extended high frequency baseline hearing test, because outside of that, I don't know what's going on in there.
right, right,
Yeah.
right, and that's and you won't even have a starting point really to work from until you get that test, the high frequency test, right?
Yeah, to me, I
Right.
mean, I can't really say anything medically unless I kind of know where your thresholds are. So
So musician, producer, whatever it is, come in, they have hearing loss, they have tinnitus, and again, it could just be one example, but sort of, how did you how did you help them adapt their ability to record and produce? Like, what advice do you give them?
Yeah. The first one I'm thinking of, he is a fiddle player
Right.
for a country music artist. And he came in the office for in-ears. And so I'm doing his impressions and, same conversation, is there anything you want to talk to me about? And then, it turns into, well, I don't think I can hear very well. And, I have my in-ears turned all the way up because they don't fit very well. And, I'm bringing my ears. It's been there forever. And I'm like, well, why don't you get in the booth? So we tested him up, just like not good hearing. So then I have to show him
Right.
on a big giant computer screen, and
Yeah.
it looks
So-
like a ski slope,
yeah.
and
Right.
people
Like
just,
mine does. Yeah. Right.
yeah, they just immediately panic. So I had to say, you know what, you told me that you had hearing loss. You already knew this. You just
Right.
didn't know how severe it was.
Yeah.
So this, I know this is shocking because you are visualizing it
Hmm.
versus hearing it,
Yeah.
but so we navigated what that looks like. And then I said, based on this, we need to talk about treating it from a performance standpoint.
Hmm.
And let's focus that there because that's why you came into my office. You came in for new in-ear monitor impressions. So, can I work with your sound guy, or, who do I need to talk to kind of help you get your new in-ears up and running? Once we do that, the other conversation I would like to have with you down the road is working on correcting this for your personal life and your social life.
Right.
So I'm not going to say the word HA right now.
Yeah. Yeah. Yeah.
I'm only going to use the term amplification.
Okay. Okay.
So, but we have,
HA meaning hearing aid, listeners. Like, no one, even as an audio, even as someone who's been wearing for 20 years, I don't like the term hearing aid. I think it,
how about
people
ears?
wear glasses.
Ears.
I call them digitals or
Digital
device. Yeah.
hearables.
Yeah. Right. They call them glasses. They don't call them eye aids. Right.
Yeah.
And that's just whatever.
Just
But
call them
yeah,
ear candy.
it's a scare, hearing that phrase, hearing
Yeah.
aid, people, especially musicians, they just run
Oh yeah.
screaming.
Totally understand. I totally
Right.
understand.
Yeah. Yeah.
So, so this specific musician put me in touch with his audio engineer, and I sent his audio or monitor engineer
Hmm.
his hearing test. And we talked, he was asking me a lot about how do you EQ this? And I was like, remember, when you are providing gain, we're not, if you have a 40 dB hearing loss, we're not putting 40 dB back in. It's a half gain rule. So, we navigated that conversation, and I was like, just give him a little bit of an EQ of, I gave him all the different thresholds where there was loss. And I really wish they would have gotten this on video, but I had a different band member of his come in a little bit later and said,
Right.
yeah, we had rehearsal the other day, and the audio engineer did the EQ that you recommended, and so-and-so got his new in-ears, and he played fiddle and just started crying because he said he hasn't
Awesome.
heard his fiddle like that in like 20 years. So just
See,
like,
that's so cool.
that's like
Right.
great. And
Yeah.
so, I don't know if it affects his performance. I don't know what affects his music enjoyment, but like the
Right.
fact that he heard more like he remembers it in his head.
Yeah. That's so cool. And
Yeah.
so basically what this is this is why you emphasize again why it's important to get that base hearing test, right? Because you can the in-ear monitors can be EQ'd like a hearing aid, right? It can be EQ'd for your loss, right? So yeah, like you said, maybe there's, I don't know, the fiddle player has loss in 4,000 K, right? You don't want to just boost all the levels, right? You can just give the 4K back. So you're
Yeah.
EQing the in-ear monitor in a way that's not unlike, it's just more complementary to the way you hear, right?
Yeah.
And of course, that, and the beauty of that too is if you're wearing in-ear monitors, you can do so anywhere you play, at least you have the same starting point, right? Because if you go to a different club and you have a different monitor in front of you, stage monitor, it sounds different every time. But at least if you're
Yeah.
in-ear monitors, every stage you're on, it's going to sound pretty much the same, right?
I mean, ideally, that's the goal.
That's
Yeah.
the goal, right? there's an adjustment level for people getting in-ear monitors and that kind of thing. This is, and again, me speaking to musicians, because I know there is this sort of, they first get them, they kind of don't like them, they kind of wish they could be back to just being on stage and having everything just yell at them.
Yeah.
There is a time, we've talked about this before, just sort of the baseline where your brain adapts and learns how to hear this way now. But it takes time, right? And there's a comfort level, there's an adjustment level that needs to happen. But I think it's important for musicians to know that if you're not really happy with your in-ear monitors,